Okay, so I think we'll start. Good morning, everybody. Thank you for coming to this session, which promises to be an interesting one. My name is Jocelyn DeYoung. I'm in the Faculty of Health Sciences and Public Health in AUB. I've been here for 12 years. And I was very happy to have a panel of 3 speakers, 2 of whom were students at the faculty. Unfortunately, so Inas is our graduate. Unfortunately, Cynthia Khouri wasn't able to join us today. She has apologized, so we have 2 speakers in the session. But I'm also very happy to welcome Aisha Rifai, who I've been lucky enough to know since the 1990s. So I'd like to welcome you all. We'll have lots of time for discussion, which is always a good thing. We have 2 presenters, and they were tied to 15 minutes, and I've given them a little leeway to go a little bit longer. But we'll still have lots of time for discussion. So just by way of introduction, I think it makes sense that this conference is starting with the question of the body, because ultimately it's the autonomy of the body which is really essential to the autonomy of women and the autonomy of individuals. And as we heard this morning, an inevitable theme of this conference is how inequities in the private sphere translate or are represented at the public level. And of course, as someone who works on public health, I'm very interested in inequities in the autonomy of the body, in health status, in access to healthcare, decisions over healthcare, and the governance of the health sector, which of course are all in this region and in most regions of the world, if not all, are profoundly gendered. So health is one of those invisible aspects of the private sphere, but at the same time, one of the most contested publicly. So my own area of research is the health consequences of sexuality and reproduction. And when you think of that, obviously we think of the burden on women, because physiologically and socially, women have had to bear the burden of those health consequences. But of course, those consequences affect every individual in society and across the life cycle. And I think this panel will probably bring out all those issues. So sexuality and reproduction are my focus, but of course those are 2 profoundly social processes that are far too often medicalized, as well as regulated and controlled by law and political forces. And again, I think these will be themes that will come out very clearly in the presentations we'll hear today. So given the connections between the private area of reproduction and the presumed public sphere of population, so population growth and the growth of societies, governments and indeed international agencies have long been preoccupied with how to control this sphere for the presumed social good. So we often hear references to the need to control fertility for the sake of population growth and of course for the environment. And that has huge implications and has always had huge implications for women as the subject of that regulation. So of all areas of health, sexual and reproductive health lie at the heart of legal, religious, and political debates in the region. And at the same time, they're widely misrepresented outside the region. Indeed, they're often used by outside observers as a means of demonizing and demeaning and demonizing the region. So I think we can see clearly the connection to some of the themes that Dean Sheikh this morning and Sarah Murad were speaking about as overarching themes for the conference. So when I was asked to chair this session, I was happy that the speakers were not shying away from some of these controversial issues and debates, whether from abortion to sexuality and sexual identity. So as I said, it's always a pleasure to welcome back students of AUB back to AUB and to engage with them as colleagues in research and other activities. So we're going to start the presentation with Dr. Aisha Rifai, and I will introduce her first, and then I'll also introduce, after her presentation, Dr. Inas Abdul-Wahad. So Aisha has had the difficulty, like we know all Palestinians, in traveling to be with us today, and was only sure at the last minute that she would get her visa to enter Lebanon. So we're very happy that she was able to join us. She has a PhD from the City University of London in health policy, and she's for a long time worked on sexual and reproductive health issues in Palestine, most of the time for UNRWA, and she's currently Dean of the Education Service Faculty in UNRWA in Ramallah, and also active in research on a number of these issues. So her research themes are sexual and reproductive health, gender and health, and she also has expertise in program evaluation and monitoring. So thank you very much, Aisha, for joining us.
Thank you. Thank you. Is that working? So good morning, everybody. Thank you for having me, and it's really a great pleasure to be here with the colleagues in Lebanon from Jerusalem.
Voice is not working.
So just a little note that I forgot to tell Jocelyn about, that we in Palestine currently are lucky to have developed a system for a national referral system for violence survivors, women violence survivors. And this came after years of hard work of strategies on gender-based violence, on gender strategies, on mobilization, on pressuring the government, etc., etc. Yet, the system has been developed endorsed by the Prime Minister, the cabinet on the year 13, but in fact we just started working on it, because the resistance and so many political issues that come into handling this. Of course, sexual violence is still in the dark. We are handling now physical violence as if they're separable, but we have started at least with physical violence, with the system, referral system between the sectors, social affairs, Ministry of Women's Affairs is involved in some components, Ministry of Affairs, of course, a major component, and with full engagement of civil society. So I have been lucky to be contracted by UNFPA to conduct 2 studies about the system already. One on a baseline study about how good the Ministry of Health is doing in that. They were not happy with the findings, but that's the baseline and that's the data. But currently I'm doing really a very interesting study. I look forward for its completion. It's about clinical management of rape, which is a black box, completely a black box. Everybody pretends it doesn't happen. Rape? Who says we have rape? And that comes from everybody, the experts, gynecologists, nurses, everybody. We're pretending it doesn't exist. And it was really very, very, very hard to collect the data and get people to speak. And I think the very idea of conducting the research itself is in itself a change step. To have people being able to say, oh, we do have that. Let's talk about it. Let's see what we do to these women. But before that, I was working on abortion, and I will still continue on abortion because we're just starting as well. So my paper is titled Safe or Unsafe Abortion Must Be Controlled, Reproduction as a Space for Contestation. And we all agree, perhaps, that reproduction is a huge space for contestation globally, not in the region, but I'll confine my paper to Palestine, and perhaps a lot of it applies to the region as well. So whether by law or by social order and culture, control of abortion continues to gain a consensus and protection in many parts of the world, including within the healthcare system and by healthcare providers themselves. In this paper, I argue that criminalization of abortion in Palestine and other barriers to women's human rights to health are all forms of gender-based violence. That's my basic argument, that is equally legitimized by society and state and reinforced, in our case, by Israeli colonial tools of aggression. Gender-based violence here is a manifestation, from my perspective, is manifested in the coercion element. It encompasses for the woman based on gender norms and unequal power relationships, taking the form of a denial of resources and access to services and inflicting harm on women. The notion of culture features in the abortion literature to explicate first contestation of the meaning of abortion, as in the culture wars about abortion. Second, the normalization of abortion in certain countries, as in abortion culture. And third, the presence of women, the response, of women to abortion within a particular social context. How do women react to it and how do they handle it? In all cases, however, culture is deployed as a discursive resource to oppose legal abortion when it's legal, or to preserve its illegality when it's not, as exactly the case as in Palestine. Its illegality we are trying to shake and change. It's strongly protected by different powers and systems, subtly, covertly, and overtly. Neglect of abortion in Palestine stems in an amalgamation of social, political, economic reasons that have rendered this crucial subject trivial in the policymaking. And as I was just saying when we started working, just as we were doing with rape, everybody was pretending that no, this is also. I want to make clear a distinction between induced and spontaneous abortion. And we all in the health field know that spontaneous abortion it's a medical issue. However, induced is compounded with so many things. So even the medical colleagues, when we started working on this subject, they were all inclined to assume that they're spontaneous. Although most signs show that no, they're not spontaneous. Women do things to get rid of the pregnancy they don't want, and they end up with incomplete abortion, with bleedings, with injuries, with harms, and of course they will resort to the health facilities, and in this case, of course, helping them is legal. However, we as researchers need to look deeper into what's behind these incomplete abortions that keep coming, and not continue pretending this is only spontaneous abortions. My account is structured around the reproductive justice concept that sees a realization of reproductive rights not as a standalone goal, but part of continuum of social justice, making it inseparable from the realization of other rights. Guided by this understanding, I conducted, and here comes the study, a qualitative study using focus group discussions with healthcare providers and social workers, and experts meetings with senior service providers, policymakers in health, gender, and law sectors. Because obviously we are aiming at changing the law, hopefully. And God knows how many years we'll succeed, but we're after that. We will change the law about abortion in Palestine. This study showed first that healthcare system and providers in Palestine, expectedly, but also in terms of extent, shockingly, in Palestine breach basic human rights of women as right holders by withholding information about the services available to them about abortion. They don't tell women about the service. Even when they come seeking them, they do not get offered the services. Hence, women care seekers rarely go to the health institutions for abortion simply because they don't know about where they can get an abortion. And even when they dig into those holes and try to find a place or some kind of service, they are not guided to the service and not given the service. Because, of course, there are lots of stigma about the abortion, so much stigma. Furthermore, women have no clue about post-abortion psychosocial counseling services, even these that can be safer, socially speaking. They have no clue it exists. Emergency contraceptive pills. They sit there, get expired, believe me, get thrown away, but not given to women. So this is the politics of how.
You better just explain what emergency contraceptives are, because the audience won't know.
Does everybody know what emergency contraceptive is? Do I need to? Okay, so I'll give quickly what emergency contraceptive is a pill that a woman can take the first 72 hours after unprotected intercourse. to prevent pregnancy from occurring.
Is it this?
No, that's for abortion. So we're talking about the emergency pill that one takes after an unprotected, and it's legal and it's everywhere. It sits everywhere. No, that's correct. So it's everywhere. In Palestine, it's available, but it gets expired because nobody's given those. So it's a wasted cost, basically. Let alone, of course, more importantly, the suffering of the woman who suffer getting an abortion. Participants' accounts of women experiences the abortion reveal important legal, extra-legal, and procedural barriers to women access to dignified abortion, depriving them from their basic human rights to health and justice, and subjecting them to state and social violence in the form of controlling their sexuality and bodies by forcing them into unwanted pregnancies and experiences of reproduction. And I argue this is a form of violence. Exactly similar exactly to the case of forcing abortion, forcing pregnancy versus forcing abortion. Moreover, in the context of cultural discussions, abortion was constructed, and that's very Palestinian, so to speak. Abortion was constructed as killing and inevitably destructive of cultural values and traditions. It's viewed as killing a human being. Oftentimes, abortion was equated with colonialist intervention, in our case, as opposed to nationalist ones. Because, you know, in Palestine, there is a sensitivity of demographic and having to produce more children and compete with our enemy in terms of the number of people who has the right to Palestine. And so and as something that should be opposed in the preservation of culture, steadfastness, and the very existence of the Palestine cause. And that makes it harder, because you're talking here not only about human rights, not only about social justice, you are equating, almost we're bringing women close to somebody who is a betrayer, who betrays the nation. She does not want to contribute to a role in the steadfastness and the cause. So this is how far it goes in our case. So one key procedural barrier to abortion is institutional and legal restrictions on abortion. A senior midwife explains it like this, and I open a quote. She says, even if a married woman comes seeking abortion without having any justifiable health situation, we cannot abort her. First, because the service is not an offer, and that's not true, partly. And second, because we are not legally protected. If we do, we are subject to legal accountability, and it's, that happens, and I've seen few people taken to court, and criminalization for violating the law. However, if she comes with incomplete abortion, we are covered institutionally and legally. So almost all of them do not intervene if it's abortion, but if it's incomplete, they are safe legally and socially and institutionally. This indicates how law serves as a deterrent to the women's human rights to health realization. Penalties extend to the pregnant woman and to all individuals and healthcare personnel who assist her in performing the abortion, just makes it harder for the woman to get that abortion. The other very big barrier is the conscientious objection toward abortion among care providers. تعرفوا الاستنكاف الضميري بالعربي. Under the claim of, and this is of course supported by pseudo-religious understanding that is not necessarily true about religion, because we have challenged in focus groups the participants about installment issues, about what the interpretations that exist in religious textual books, in terms of what it says of abortion, the 120 days, all that. But in Palestine, the prevalent view that it's forbidden and it's a big haram and you will go to hell, even if it's one day, and nobody buys any story, any information that says there is a window of action, even if small, but there is. Nobody wants to see that. So they all clinch to the story of conscientious objection and that they have the right not to give the service to the woman. Not only that abortion law is fairly restrictive, but also healthcare providers themselves, especially OB-gynecologists, regretfully. Obstetricians and gynecologists are the most prohibited people to this. Have a substantial conscientious objection stemming in their religious and moral convictions. A nurse, also from the government sector, have stated this like this, and I open the quote. It is impossible that I can kill a human being. Only if the woman's life is endangered by the pregnancy I would. And for this, she will have to provide me with the fatwa. What I can do is to give her health education on the risks associated with abortion, but if she is not convinced, after all, I'm not her only option. Close the quote. So the only thing she will tell her to scare her off abortion, basically. That's what she will do. Linking this to the client right to choice, the same nurse did not see any connection and went back to the legally imposed restrictions, so they jumped between the religion and the law. They hide behind the law, basically. And that's why we need to focus more on changing the law and shake, although law enough is, of course, law alone is not at all enough, but it's only one step. Also, lack of providers' professional practice regarding abortion. They don't know. Not only that, they do not want, they do not know. Poor information about how to handle, what to do, what kind of care, how psychologically vulnerable the woman is. Nothing. Abortion as a taboo, both normatively and religiously, was a strongly held notion amongst most focus group participants, who are all health professionals from different disciplines, medicine, nursing, etc., etc. Some even argued for its absolute prohibition in Islam. As I said, they have this understanding, including where the pregnancy gestational age is at less than 120 days, and I'm not going to dwell into that, but we all know that there is this story of installment and the 120 days, and there are lots of fatwas about the possibility of religious permission to do that. But in our study, it came out that almost all believe that from day one, it's haram, you'll go to hell, etc., etc. In the context of this obvious confusion about gestational age of pre-installment abortion permissibility, explaining about their abortion-related services, participants reported that when the woman approaches them for abortion, they, and I open the quote, provide her with counseling, with religion being the chosen entry point, and tell her that abortion is prohibited in Islam, so they become breaches in Islam, and advise her to reconsider her decision. When she goes to the health sector, she gets breached about Islam and how haram she cannot do that. Not their business, basically, but that's what happens. This means they refer to their own beliefs and not professional code of practice, whereby they, being the duty bearers, are accountable to respect, protect, and fulfill the woman's right to health, including with respect to abortion as well. What is more is that, reflecting rather judgmental attitudes, participants voiced serious concern and strongly warned against the risk of promoting abortion in an open, uncontrolled manner, because as such it could encourage sex and extramarital pregnancy. That was a big, big issue. What are we going? Okay, I will done. So Joyce is telling me I have to finish. Okay.
5 minutes.
Okay. Lack of government commitment by unfavorable public, triggered and supported by unfavorable public commitment. The government, after all, even if there is one person, one decision maker who's interested, he will fear the public opinion, of course. And currently, the public opinion is not at all ready in Palestine to do this change, which means that we in the health activism work and the women movement and gender experts, we need to do a lot of work in changing this environment and understanding. I will really go to, because there is some So far, it does not look like contestation. Everything goes in the same direction, right? But I will come to the contestation part in a minute. Imposing extra requirements, and I will not dwell into it to save time, but this is specifically when the woman have a pregnancy out of rape or incest. And sexual violence, according to the latest national survey that has been completed by the Palestine Central Bureau of Statistics, revealed sexual violence to be sitting at 11.8%, all put together in one category of it. Of course, there is all categories of sexual violence, and a part of it is incest. Notably, lots of honor-killing victims are also victims of incest and being raped by their family members. So here also additional barriers are, of course, because this poor woman never gets the acknowledgement that she's a victim. She's demonized, she's the whole story of being on the wrong side of the story. Okay, I will, sorry. So, this dark and sad picture is not left alone. And here comes the contestation. It is increasingly contested and challenged by women and health advocates in civil society in collaboration with the government actors, using two juxtaposing theories of change. The first is the coalition theory. The coalition theory by Jenkins, Smith, where policy change is thought through coordinated activities among a range of individual organizations with the same core policy beliefs, using multiple avenues for change. This is where, in fact, very useful avenue has been lately, a few years on the go. The National Coalition for the Protection of Women from the Dangers of Unsafe Abortion, founded and led by the Palestine Family Planning and Protection Association, but also it serves as a platform for augmenting all efforts for achieving the changes aspired for through lobbying, persuasion, and pressuring policymakers and political leadership to put the question of abortion on the development map and national strategic health plan. Participant agreed, and in fact I am in this forum platform, and we just had a few months ago with the Prime Minister a very strong meeting about this. So we are pushing and we are pressuring to put this on the agenda. This includes integration of abortion-related indicators. We requested, that is the latest thing we did, into National Maternal Health Database to be reported on the PCBS, the Palestine Central Bureau of Statistics, and future health surveys, because they do every 7 years, and the Ministry of Health annual report. We want to see data on abortion in these reports. The coalition has been actively engaging in legal advocacy. This is what the coalition is how mobilizing, changing public opinion, and changing perceptions about policies through research, knowledge generation, and information exchange. Holding the first national conference on abortion, conducting seminars, workshops. For example, Ministry of Education and Higher Education was the key partner for the coalition in outreach project activities, different projects in schools and universities. We targeted intensively universities in Palestine and schools through the Ministry of Education to change the minds of the younger generations and impact. Legislative Council members is the hardest group. They are so reluctant to cooperate, they do not come to meetings, they just don't want to be part of that. For example, Ministry of Endowment, surprisingly, has been cooperating, especially Women Work Department facilitated substantial investments in the role of most breaches. We convinced them that a health professional will be in the mosque with them while they do the breaching. And we jointly develop the material for the breach to be health about abortion, but also, of course, for them Islamic kind of stuff. And this, for us, it was a protective measure, because the women in the mosques were more so receptive to what we in the health sector have got to say about abortion. Like we use them as an umbrella to give the legitimacy for what we're saying about abortion in their presence and their approval. We need to make use of what's there. By so doing, the ministry visibly registered the religious establishment approval and support of the awareness subject matter and the IEC messages it held, serving as a driver for changing public opinion, slowly though, of course, we are aware, but starting on the subject of abortion. Secondly, grassroots or community organizing theory together, policy change, after policy change through collective action by members of the communities, CBOs, community-based organizations, youth groups, women groups in the communities, engage them in festivals, theatrical performances, cafes discussions, like a health professional will go to a cafe and sit out in the street and start talking about it, like normalize it, like train their ears to hear stuff about abortion and be positive about it. First, some of our people, especially young men, when they targeted men, they were kicked out of places. They were told to leave. That strong, but gradually this is happening. So to cut it short, this is what Weiner calls proactive contestation. In our case, we are not just contesting what's been said, we are doing deliberate actions of contestation proactively. Thank you.
So thank you very much, Aisha. Fascinating presentation, and I'm sure a lot of people will have questions and comments. So we're having just heard about the contestation at the political level and the ramifications at the political level of the very private act of reproducing and abortion. We're now going to turn to a presentation which looks at the representation by the media of sexual and reproductive health in Egypt. And it's, in Egypt. So I'm going to have the pleasure of introducing Ines Abdelwahed, who is a student of ours in public health and is now, she has a background as a physician in Egypt and was very active in civil society before going to do her degree in public health. She's worked on HIV, she's worked on sexual and reproductive health in humanitarian settings. And so we're very happy that she came back to join us at this conference. So I was wrong, actually, it's Lebanon, sorry.
Yeah.
So the topic of her presentation is sexual and reproductive health in Lebanese newspapers, a content analysis. So thanks very much, Ines. I'll pass over to you. Maybe we can put it on the stand, so because you have a presentation there.
Good morning, everyone, and thanks a lot for being here. I'm really honored to present today a study on the sexual reproductive health in the Lebanese newspaper, a content analysis. This study was written by me and my colleague Ruba Abla, and was with the supervision of Dr. Rima Afifi. Unfortunately, we can't have her here. So before we go through the study, I just want to answer two questions. Why we choose feminist theory to analyze the articles, and why we choose sexual and reproductive health articles. So feminist theory simply analyzes and portrays how gender rules and the imbalanced power relations between man and woman can affect women's health, and particularly sexual and reproductive health. And of course, the definition around masculinity, homosexuality, and heterosexuality can affect women's decisions through their bodies and around the sexual reproductive health decision. Other things such the social identities, race, ethnicity, and the social class can sometimes restrict their access to sexual reproductive health services and other things that directly affect their health. So we focus on sexual reproductive health because the classic epidemiology and classic health usually focus women's health and restrict women's health to sexual and reproductive health. And this is somehow make us see women and value their health status only determined by their ability to give birth and raise children. We also think that, we also found that epidemiology usually decontextualize the risk factors and focus on the disease without leaving the social context and the political situation where women live in unquestioned, which we think and we know from fact that affect women's health even more than disease and the risk factor directly. Given that we're analyzing sexual reproductive health in the Lebanese media, the social context where the Middle East countries in general, patriarchal societies in particular, can give a clear example on how gender power affects reproductive health. So interfering in women's decision on their reproductive health decisions and their access to resources directly affect their sexual reproductive health, and also taboos around sexuality and the culture of silence around sexual health also affect their reproductive health. So we're analyzing print media, particularly newspaper, because we think not only media shape the public awareness, but also can give an indication on how society perceives women and how society give an indication of the position of women in the society. So we're reviewing print media to assess the coverage on sexual reproductive health topics from a feminist point of view. So for the methodology, we used qualitative research, of course, a deductive approach, using critical discourse analysis to analyze the newspaper. And for the newspaper, we obtained them from Knowledge to Policy Center, K2P, a center in the Faculty of Health Science and AB, because they track the health topics published in the Lebanese newspaper daily to document them. So we obtained 10,186 articles, and then we used keywords that directly can link to sexual reproductive health to have 718 articles. And then from a quick scan, we excluded some articles that we think are relevant to have in total 89 articles for the study sample. The articles were actually, we obtained them online. They were online, but for a few articles we could not obtain online, so we obtained them from Jaffet Library, microfilms from the archive. I'm not going to go through the methodology so deep because we don't have time, but we used few variables to analyze the articles. For example, the imbalanced gender power, whether they talk about women's autonomy, whether they perceive the social political factors as a determinant of sexual reproductive health decision, and the term used, whether they were neutral, gender neutral, whether they use victim blaming tone, and other variables. So for the results, out of the 89 articles, we found that the majority of the articles were around gender-based violence. So 35% of the articles were around gender-based violence. On the second lab, we found sexual health constituting 21% of the articles, and then for the breastfeeding, for 18% of the articles were around breastfeeding. I'm going to focus on the three themes for the interest of time. So if we want to analyze the article based on the topic, if we will take gender-based violence as a topic, we found that most of the articles on gender-based violence were written on sexual abuse events or rape events. So they were mainly driven by an events already happened in the Lebanese society. And all of the articles addressed the gender-based violence from a policy level, on a policy level where they think that the absence of enforcement of a protective law can be directly linked to the repetitive events on sexual abuse. Only 7 articles talked about domestic violence, and it was written from a policy, on a policy level also. Other than the articles that were written on events, we found that almost 54% of the articles were stories on sexual harassment in workplace and in the public sphere. However, we found that only 1 article of those articles were written based on testimonies of the victims. So women's voices were not there in the articles, although they were actually talking about women having sexual harassment experiences. Almost like 20% of the article discussed the issue on community level, but no article discussed that the imbalanced gender power can be, or patriarchy can be seen as a main determinant or factor for gender-based violence. Positively, we found no victim blaming tone in the articles talking about whether the rape events or the stories on sexual harassment. For sexual health, we found that the majority of the articles were around female sexuality. Hence, the target audience were mainly women, and men were only targeted in 1 article talking about impotence. So there were no involvement of men when talk about sexual health in the Lebanese print media. However, we found only 1 article talk about the importance of having sexual education for youth and teenagers, and 1 article talks about sexual rights of the LGBT community for lesbian, gay, and bisexual, transgender. And so we think that most of the articles were talking or discussed sexual health from a very traditional and biological medical perspective, where a disease was mentioned and how to prevent the disease or how to treat it. where other factors such as the culture of silence, the political and social inequality, or the institutional oppression of women were not addressed as much. 30% of the articles whether mentioned or talked a little bit about those actions, those factors. So we think that most of the article were talking about sexual health from a very intimate and personal perspective. I'm just going to talk a little bit about breastfeeding, because we might argue whether to include breastfeeding or not in the sexual and reproductive health, but we choose to include it because we think it directly affects women's reproductive health. And surprisingly, we found that the print media perceive breastfeeding as a reproductive right rather than a body right. So they don't perceive breastfeeding as a personal right for women to decide whether to breastfeed or not. However, they think that it's a reproductive right. And all of the articles talked about the importance of having encouraging and enabling environment for women. So they talked about the importance of having a protective law and the importance of passing a law to penalize hospitals that promote formula milk. So this transition from a body right to the institutional policy, although we found it's positive and it's encouraging, but we found one article talked about that this shift might actually put a pressure on non-lactating women by stigmatizing non-lactating women for not meeting the standard of good mothering. We also find that only 8 articles out of the 89 articles talked about child marriage. And the term used was actually a bit challenging because they use most frequently the term early marriage. They don't use the term child marriage. However, we think that child marriage is more in line with the feminist narrative, since it gives an impression that there is no consent in this marriage. And only one article discussed the fact that involving men is crucial to end this phenomena. All of the articles around child marriage were somehow against, or all of them were actually against, and all of them provided suggestion on a policy level to set a minimal age for marriage. Religious views that we think that strongly affect this phenomena was not mentioned at all in any of those articles, except of one article where was written on a critique on one of the religious leaders' speech on child marriage that of course was supportive for child marriage. And although the general direction of the articles were against child marriage, but the slogan and hashtag was used in the campaign against child marriage was seen regressive and patriarchal, a bit patriarchal. So if we want to analyze all those articles, whether the representation or the narrative used, we think that media portray women through a lens of patriarchy rather than seeing them as independent agents. And also we found that there is a minimal representation for involving men in the sexual reproductive health articles, as only men were targeted in one of the 89 articles. And on the positive side, we found that there was no victim blaming tone in any of the articles talked about gender-based violence or sexual health. And some articles around sexual health were actually promoting women's autonomy sometimes. Breastfeeding was actually an interesting element to analyze, because we think that articles perceive women as actual producers rather than consumers, and they think that women can actually achieve an economic value by breastfeeding their children and not depending on the formula milk. And this transition, this shifting in the narrative is aligned with the new paradigm that the annual breastfeeding and the Feminism Symposium called for. So they think that they clearly confirming the need for supportive environment for women to breastfeed. However, aside from analyzing the terms, if we want to talk about the representation of women coming from minorities or from certain communities, we find that there's a minimal representation for that. For example, if you want to take refugee women, we find that only 5 articles talked about refugees, and actually the general tone was negative, because they were restricting women in articles around controlling fertility, talking about the maternal complication that they might face in the humanitarian setting, sometimes talking about child marriage, of course, and cyber sex sometimes. So the general tone was negative, and you can sense a lot of worry and fear in those articles. And actually family planning, although it's a very important topic, an element of sexual and reproductive health, but we found no single article talk about that. But the term family planning or contouring fertility or any term that can indicate family planning was only mentioned in articles around refugees. And this somehow bring a key dichotomy in the discourse on reproductive health in humanitarian setting. So women feel that sometimes she's pushed to conceive, to compensate for the lost population, or she's sometimes pushed to use family planning that most of the NGOs promote for, actually to decrease the risk of maternal complication, of course, but both scenarios lacks promoting women autonomy in any of these decisions. So back to the terms, we think that sometimes the print media use the feminist terms. So when they use violence against women or domestic violence or battered women, so these terms indicate that the violence is directly against women, rather than using terms sometimes wife violence or family violence. But it's important to note that family violence was only used in articles discussing passing a law to control women, to protect women from domestic violence. We also find that only one article focused about the imbalanced gender roles as a key determinant for gender-based violence. As for child marriage, we think that the slogan that was used in the campaign against child marriage is patriarchal. So using the term طفى قبل وقتها means that it objectifies women actually, and it minimizes their autonomy of choice. So despite that the whole articles were against child marriage, but sometimes using terms such terms are actually very controversial. So in conclusion, we think that the online print media portray women to be very patriarchal and traditional, and we find there's a minimal role in representing health articles in general in the print media. So we find 89 articles out of the 10,186 articles talked about health, and particularly sexual and reproductive health. So we think that it's important to establish a collaboration between health academics and the social scientists with the journalism to have more feminist discourse and gender-neutral messages and health articles. The limitation, we only analyze print media articles that was online. Of course, we print some of them from Jaffet Library, but other media outlet was not included in the article. And we would like to acknowledge and thank Knowledge to Policy Center for providing us the articles for this study. Thank you.
So thank you. Very interesting presentation again. So I'm going to take the liberty of taking 15 minutes. We were supposed to end, I think, at 20 to 12, and if we could go till 11:45.
Thank you so much for the wonderful presentations, and I'm happy to see Aisha here. We don't see each other in Ramallah. Actually, my question is directed maybe to both, but basically to Aisha. You know, of course, the sensitivities around the reproductive health, especially after Oslo, and the obsession of donors by the reproductive health of Palestinians, focusing mainly on family planning. Let us assume that UNFPA did not show interest or provide funding for the issue of abortion. Would all these coalitions and studies and etc. will be done? Thank you.
Sally Hanafi, professor of sociology here at American University of Beirut. So to Inas, did you find any difference in articles reported in newspaper, whether contributor author is faculty or not? And whether in the article there is interviews of academics or researchers. This is my question. And for Aisha, many of things you said, I mean, it's not typical about Palestine, but about the region, except maybe the colonial issue. We have a colleague, Zainab Al-Halla, who did her PhD about abortion in Lebanon, and most of what you talk about is it's in Lebanon even, and this work just to disentangle Palestine as exceptionally.
Right. Okay.
Yes.
Okay, go ahead. Sorry, I don't know your name.
Frances Hasso, Duke University, Gender Sexuality Studies. So I love both papers. Thank you. And for Ines, I just have an empirical question, which maybe I missed, which is what are the years of the sample? And then for Aisha, I've been researching issues of life and death of children. And so I remember I talked to a doctor of the Hilal, and he said that there's a pill that's actually widely and kind of secretly prescribed, which if you come in and you say you have a stomach ache, and there's a kind of internationally known medication that's for something related to the Ma'da that actually acts as an abortive agent, and I was wondering if you heard about that in any of your, and this is Hilal in Palestine. And so remember, a lot of the doctors who are of a certain age, they were trained in the Soviet Union and in Eastern Europe.
Right.
So actually, depending on the age and then the training of medical professionals, they draw on different kinds of histories and knowledge in relation to this. But I was wondering if you heard about it.
Okay, so that's, okay, so we'll take one more question and then I'll hand over to, is that okay? One more question? Great, keeping track here? Okay, so please introduce yourself and say to whom you're addressing your question.
Hello, so I'm Jumana Zabani. I'm from Save the Children. And I was going to exactly say what Dr. Hanafi said about the thesis of Dr. Zaina Fathallah, which is exactly what you're doing, Dr. Arifai. But my question is to Dr. Abdul Wahid, a very interesting study you presented. I wonder, what was it, when you mentioned there was only one mentioning of men in 89 articles, and it was only about impotency. What was it you were looking at? What were your expectations? What were the things you were looking at to analyze articles from a man's perspective? Because that's a debate, as you know. Thank you.
Okay. Thank you.
Only one functionalized.
So I'll start. Islah, she's not here?
No, she's there.
So yes, your question, of course, is very legitimate. But we all know in Palestine, we are donor-driven. We know that lots of our work is triggered by priorities and needs identified by donor organizations. However, the question of abortion in specific has been first, if we want to go back a bit in history, has been first initiated by the Palestinian Family Planning and Association, not with UN money of any UN agency. Just like if you remember back in history when the Palestinian Family Planning Association started with the family planning methods before all these UN agencies were there, and it was a very tough step they took then, and they were fought against strongly by everybody when they started. So to give them their rights in that, Family Planning Association has been always historically taking the lead in quite challenging issues that we, Dr. Hanafi, we know they're there. Why do we do research? We know they're there, but we want to create evidence because everybody claims no and plays games, especially when you come to policy. Politicians do not want to do anything about it. So you want to create the evidence that we're similar to the Arab world. Of course, we will not be unique except for this colonial component. However, we wanted to create the evidence because every time we raise these issues, we put them on the table, they are strongly resisted. So we needed to create some evidence. And in fact, Dr. Islah, the Palestinian Family Planning Association is planning together in the very early stages, but I would like to say that with the Palestine Central Bureau of Statistics for a national survey on abortion, and with their own budgets not from UN sources. However, to be honest and frank, we know that lots of projects are donor-driven in Palestine. We know it, even our government. However, what also drives us, the signature that we endorsed lots of the agreements lately politically, which we are held accountable now, as a state, so to speak. So this is also another thing. We need to speak to our commitments as a state. So I don't know if this speaks to what you had in mind, and Dr. Hanafi, also your idea. I don't know if I answered my, Dr. Zabani, what was your point? I forgot, honestly.
There's a similar study.
Yeah.
It would be nice to look at.
I would be very interested, and we will proceed working on abortion and rape specifically, because we need to provide the evidence. Everybody's claiming who do not want to act on it. We are pushing for policy changes, and to be able to push for policy changes and legal changes, you need to provide that evidence that this is what's there. Dr. Sorry. To be very honest with you, I didn't hear of such a thing, although I'm curious, and I think I'm an insider, but
it's undocumented.
Yes, but maybe the valid point you have raised, there is this community of ex-Soviet Union graduates, especially in the medical profession, because you know there were lots of scholarships before for medicine, especially in Palestine, in the Soviet Union. So they back home, they are like their own communities, just like graduates of every other spot. If they become a community, they have their own inside, if you like. But maybe he's talking about cytotic. Cytotic is another story. It's another thing. Yes, it's another thing. I don't know what is.
If it's children, it's
exactly.
not misoprostol.
I don't know. Cytotic is another thing.
But it is a gastric ulcer medication.
Yes.
That has a
Maybe he's talking about
And
that.
it's widely known in the
But
world.
it's forbidden. in the
Cytotec is
market.
misoprostol. It's the
Yes,
same
it
thing.
is. But it's forbidden in the market.
Yeah.
You can't find it in Palestine in the market. Cytotic. You don't.
People get it.
In the black. I'm talking about the market, but not the market. You see, so the market, you don't see it. So that's Ines. Thank you. I don't know.
For the first question, Dr. Sally, of course we found difference, and we included that in the study, but we had no time to present that. For example, on articles on sexual reproductive health, most of the articles that acknowledge the importance of talking about social injustice or the institutional oppression and its link with sexuality were written by Dr. Faisal Qaq, one of the professors of FHS. So that actually brings the question whether such people should be in journalism and disseminate their ideas. And on the other hand, most of the sexual reproductive health articles that talked about sexuality from a very traditional medical perspective were written by gynecologists. So we found differences between the authors. And of course, for the second question, for the time duration, I forgot to mention, I'm sorry, it from August 2015 till July 2017, so for 2 years time period. For the last question, mentioning men, we think it's important for two questions. First, that we find that most of the article isolating the topics, so it's whether for women or for men. So there's no involving men in women's issues and involving women with the men's issues. So only one article targeted men, and it was impotence. So it's male sexual dysfunction. So any other topics that talked about female sexuality or female reproductive rights, they did not involve men, although we know that men highly influence women's decision on such topics. And for the second reason, we think that this actually means that people perceive sexual and reproductive health as women's issue only. So men has nothing to do with any of those issues. So mentioning men only in one article on impotence actually indicate these ideas. Thank you.
So we have 6 more minutes, and I'm going to take every minute. We have go 1, 2, and 3. There we go.
Thank you for interesting presentations. My name is Najla Ahmadi from تجمع الباحثات اللبنانيات. I want to ask Aisha, you did not clarify enough what happens to extramarital pregnancies. I mean, especially in the light of honor crimes and stuff, you cannot kill all the women who get pregnant outside wedlock. So what happens there? I liked very much talking about breastfeeding because this is a role in which women are active and not recipients, not victims. So, I mean, do you recognize this perspective in your study?
Okay, thanks, Najla. Arula?
Space of agency.
You need a microphone here, please, in the front row.
Hi, my name is Rula Yasmin from the A Project. So I have a question لعايشة عن موضوع الإجهاض. فعم تفكروا أنتم تشتغلوا بالبوليسي واللوبينج وعم تقولي إنه أكثر يمكن معقول يروح هذا باتجاه العنف الجنسي والاغتصاب وسفاحة الكل وهيك قصص. فمن الأشياء اللي شايفينها نحن إنه across the global south في كثير بلاد مثلا بالبرازيل هن عندهم قانون بالأخص على abortion in the case of rape and incest وهيك. وكل شوي بيصارعوا لياخذوا بعد حق وبعد من الكونديشنز. بس هي كل ما يتغير مثلا البرلمان عندهم بيصيروا بيجربوا يسحبون لهدول بيصيروا يعني هلا in Brazil there's a huge fight على انه they're trying to take back abortion in the case of rape and incest. So my question is انه كمان reading on the history of the policy towards abortion and changing the laws, which in Lebanon is also a post-colonial law. The question بيصير هو انه personally I don't think that it's okay to push one and not all of them together. لأنه I think that all of them are subject to being reclaimed at some point. Well, this is something that happened in the States before Roe versus Wade. Before that, they were pushing all of them, and then they pushed only in conditions. So, and now they're restricting abortion a lot in the United States due to these conditions that already. يعني نحن بس نحن نصير we play this game with them, they play it back later. So I'm wondering, what does that mean? بصير في مثلا كمان ما بعرف the case in Palestine, but it's very hard to prove rape. يعني and then issues will come up as in, did she really get raped or is she just trying to get an abortion? Which, I mean, looking at patriarchal notions in the newspaper is going to take that way. So what did you guys think about this and what's the plan?
I'll just take the last question and then I'll give you the floor. Go ahead, please.
I'm introducing, my name is Hanan Ibrahim, I'm from Jordan University lecturer. Actually, yes, I agree with many of the speakers that the issue or the restrictions on abortion are not unique to Palestine. In many rural areas that they are referred, we have even, worse restrictions. And you've been actually comprehensive in talking about many dynamics that relate to the issue of abortion, but actually I felt, we need to hear more about the ethical dimension of abortion. We were all the time listening to the restrictions, but wouldn't there be any rules about, the ethics of abortions? A woman can come anytime. Are we saying that a woman can come anytime and say, well, I want to have abortion? If for a while, we forget the specificity of the Palestinian question or the Palestinian situation. What about this, I think important dimension about ethical abortion? Thank you.
Okay, so I'm going to give back to the speakers to respond. Aisha, you want to start?
Thank you, Jocelyn. But I'm sorry, I forgot your question. I started Alzheimer's. Oh yeah. Extramarital abortion, that's a very valid component, of course, but I had to cut, as I, consumed too much time, I had to cut it off. But what happens with these ladies? These ladies are dealt with their case jointly by the Ministry of Health and Ministry of Social Affairs. There are the shelter homes for victims and survivors. What happens in these cases, if she does not abort, if the pregnancy continues, she is made very harsh conditions. She is made to sign that she agrees to be delivered by C-section. She is made to sign that she agrees to give away the baby. She is a paper with details, not to see the baby, deliver with the C-section, agree to give away, but even not to see, so that no attachment happens. And why not normal delivery? Because they fear the consequences if any complications happens, because such victims of rape, they do not cooperate in labor. They're in so much pain, psychological and trauma, so they fear she does not cooperate as a birthing mother, and so they fear something happens, so they want to be on the safe side. So she signs all these conditions, very harsh, and she gives away the baby. And then she stays in the shelter of the social affairs ministry. There are a number of shelter homes. And after a time, she is brought either to her community or a special arrangement the family does. She is taken away, of course, if she comes in early stages, and usually they come in early stage. She's hidden in the shelter until she's hidden, exactly, from society. She's hidden in the shelter until the time of birth comes. So they hide her away in those shelters, and then she is made to deliver with these conditions, and she signs. And then after, if all is over and the baby is given to the adoption system of the ministry itself, under very strict conditions also, and that's what happens with these victims. No abortion, no, the law doesn't allow it. Now that's the crime, that's one of the worst crimes. And she is made to continue with that pregnancy. Legally she cannot. That's one of the things that drives us so crazy about it. Even that she's not allowed. So that's the question.
So I need to give Dinas because we're going to run out of time. Sorry.
I will be quick. Shall I give it to Ines?
No, if you have one more.
Yeah. I forgot. Keep forgetting. Yeah. About the abortions, of course we are aware that the laws and the policies, this is cyclical process. It's never one time go. All over the world, everywhere. We are aware that it's not once if we take them, they hold the risk of being reclaimed. Plus, we in Palestine, we do not have the resources and the human resources and the financial resources and other resources to work on. I agree with you that it has to be a full package. I can see the point and I agree. But practicality and resource-wise, we are not able. Let alone our governments are in a state, very unstable. It affects, of course. It's not a stable situation. So, but at least we need to work on it. We need to do something. At least, for example, if we can make a change regarding the rape victims. If we can do that change, that's a big achievement. We need to get to do something about it. Hanan question.
The ethics of abortion.
The ethics of abortion, but the whole thing is a black box. We are opening up and newly, it's not new, we are newly able to open up and speak about this and address them. To be very honest, we didn't come to that because in the start, the services are not there. The services do not exist as per abortion to talk about, to address, which is important, the ethical dimensions. However, maybe we touch on it about when we talked about conscientious objection and a bit, but the way you are addressing it, frankly, we did not come. However, I want to quickly talk about the male engagement. Dr. Islah, about funding and all that. What we are doing also now is that we are gearing academic research through the thesis work for students to doing research on violent GBV. For example, I'm supervising a master's student in Al-Quds University. She is investigating pre-service preparedness in health specializations in university about their knowledge about the referral system for GBV women and all this kind of thing, males and females in the medical school, nursing and midwifery specifically. The last year students of the university in this specialization will be investigated. That is to say without funding. So we are benefiting from also thesis work to enrich this area research-wise. Thank you.
For the question on breastfeeding, we cannot say actually that we found this narrative, unfortunately, but most of the articles were talking about how breastfeeding can achieve an economic value, but they were not. The articles were not tailored in a way that to think that women are achieving this. However, we think that it was written in a way to act as an incentive maybe for women, so they can save money and breastfeed. But that narrative is a bit progressive, and we could not find it, unfortunately. Thank you.
So I'd like to thank the speakers very much for these stimulating presentations. And before we close the session, I just would like to make a plug or stay tuned for 2 upcoming events in March, which may be of interest to this group. So the first one is the Lancet Palestinian Health Alliance, which will be taking place at AUB and addresses many of these relevant issues. The second one is that we're launching a special issue that a research network that I coordinate that was actually founded by Dr. Rahul Zreif, who's sitting here, and is governed by a number of regional scholars in the region. We're hosting an event on a special issue that was called Gendered Bodies and Reproduction in the Arab countries in Turkey, and that's in March. So maybe we can coordinate the mailing list so that some of you can attend. Okay, I'd like to thank you all for your questions and engagement, and very much thanks to the speakers. You more than made up for the absence of Cynthia.
You both did excellent presentations, really.
Thank you, John.
Excellent. To run.